But we're going to move on to a very common type of discount that is regularly utilized and accepted, and one that's actually fairly easy to put into place and stay within the confines of the regulations, and that is prompt pay discounts. So an example of this would be offering a discounted rate to a patient if they pay their bill within a certain period of time. So that could be like payment on the same day of service or within 15 or 30 days of the patient receiving the bill. The idea behind offering a prompt payment discount is to boost collections and save time and money that you would normally spend on billing and making those collections happen. So we have some guidance from the Office of the Inspector General. They have said that prompt payment discounts are permitted if the amount of the discount relates to the cost the practice would endure to collect the amount. So essentially, your discount should be relative to your collections cost. The discount must be offered to all patients for all services and items, regardless of their diagnosis, length of stay, or treatment, etc. So you can't apply a prompt pay discount to certain services. It has to be kind of across the board. The prompt payment discount may not be advertised in advance, so it's something that patients should find out about on the back end when they're going to pay. Costs may not be shifted to Medicare, Medicaid, or other government programs, and you must notify your private payers, third-party payers, before you can institute your prompt pay discount policy. You should also consider your own state law in addition to the federal statutes, like the anti-kickback statute, when you're putting together your prompt payment policy. So an example, I don't know why we're using Idaho as the example state today, but they, like Daphne said earlier, they have a very specific anti-kickback statute that kind of forbids their providers from giving or paying any of the claimant's deductible or claim for health insurance. So you're not allowed to offer very many discounts at all in Idaho, so it's important to check. Violations could result in a $5,000 fine per item, so that could add up pretty quickly. It's not clear whether an established discount policy would constitute a regular practice of discounting copays and deductibles, like Daphne talked about earlier, but providers should carefully consider their program in light of any state laws. Also, a lot of your third-party payer contracts require you to collect the full amount of copays or deductibles, so offering unauthorized discounts, especially where there's no showing of financial need or unsuccessful collection efforts, could result in claims for breach of contract or insurance fraud. So you really need to look at your third-party contract and make sure that they allow some sort of like prompt payment discount, or if you're discounting any of your collections. There's generally less risk if the discount is tied to the cost of collection efforts, so that's just something that we recommend when you're looking at how much your prompt payment discount can be. Next slide, please. We also have an OIG advisory opinion. As you all probably know, the OIG offers advisory opinions upon request to opine on the likelihood that certain arrangements will run afoul of the anti-kickback statute. So in this specific advisory opinion, number 8.3, the OIG approved a hospital's prompt pay discount on patient cost-sharing amounts and amounts owed for inpatient and outpatient services. Under their proposed program, the hospital was going to give a 10 to 15% discount on balances paid before discharge and a 5 to 10% discount on balances paid within 30 days of service. This discount program applied to all services, both inpatient and outpatient, and to all patients. So the OIG found that the discount given for inpatient services fell within an AKF safe harbor for waivers of beneficiary coinsurance and deductible amounts for hospital inpatient services.